Hi, Madeline.
Yes.
Hi, nice to meet you. I'm Blake.
Hi,
Do you
Blake.
go by Madeline or do you prefer a different name?
Maddy, please.
Maddie. All right, sounds good. Very nice to meet you. So we're going to be hanging out and talking for a few minutes. Are you most comfortable sitting like you are? Would you rather lie down or stand, perhaps, or do you think you're good?
Sitting's fine.
Sitting's good. All right. So I took a look at your chart. It looks like you're coming in for your wrist. I see a few things on here, but how about you just tell me a little bit more about what's going on in your own words?
So I have a cyst on my wrist
Okay.
and pressure on my wrist hurts.
Okay.
So doing activities that are pushing, lifting really heavy things, going back on the wrist like this.
Okay. How long has it been bothering you, do you think?
Probably 3 to 4 years.
Okay. Have you had any treatments for it in the past?
I went to a chiropractor,
Mm-hmm.
and that was not helpful in that they were trying to pop it back in place, and
So they kind of popped it.
mhm.
Okay. Did they inject it at all?
I then went to a wrist specialist and had cortisone injections,
Okay.
and that relieved some of the pain for a few months and then wore off.
Okay.
I've also done some physical therapy on it.
Oh, you have. Okay. So did you have any imaging or anything like that done? Any X-rays or anything like that on the wrist?
I can't remember.
Okay. And you said you went to PT beforehand. So what made you choose to come here instead of what you were doing before?
I just went to one session at that physical therapist, and the pain that I've now been in has prompted me to go and try it again.
Come again. Okay. So you said a little bit about what hurts it the most. Some pushing, putting pressure on it. I see here that you like to do some tennis and some working out, like push-ups and stuff like that, and even some typing. So would you say those 3 exercises are kind of the thing that aggravates it the most that you find?
Yes, like push-ups, tennis, that kind of movement, and also I have a desk job, so I'm
Okay.
constantly on the computer.
Okay, that's what I was going to ask you next is what you do for your job. So you're on the computer a lot, typing.
Yes, on the computer most of the day, typing.
Okay.
I am an interior designer, so I'm using the mouse a lot too.
Okay. Does it bother you every day or just when you're on the computer longer that day?
Long stretches on the
Okay.
computer.
How many hours do you think is a long time?
Past 3 to 4 hours.
Okay.
Constant.
Okay. And then some hobbies you like are tennis and working out, and that seems to kind of bother it as well.
Correct.
Okay. So how long? Okay, so you said it takes a couple hours to aggravate it while you're typing. What about when you're exercising or playing tennis? How long does it take to start
It just
aggravating?
depends on the movement.
Okay. So once you feel it kind of start to be painful and get worse, how long would you say it takes to calm down?
Immediately, if I feel, if I do a movement that hurts, I stop.
Okay.
And then it's fine.
Okay. So after you feel that pain and you stop doing what you were doing, say you went to go grab something out of the fridge or move something out of your way, does it hurt then when you do that?
It could be a little sore.
Okay.
And sometimes I'll see myself doing some wrist movements.
Okay. So that's what I was going to ask you next. Is kind of what do you usually do to calm it down? Do you ice it? Do you take any ibuprofen or an ice?
Yeah.
You kind of said you move it around a little
Ice,
bit.
ibuprofen, some just.
Okay. Does that seem to help?
Yeah.
Okay. Kind of brings it down in the meantime.
Mm-hmm.
But then once you go back to those activities, it bothers
Yes.
you again. Okay. If you could explain the type of pain, what would you say? Would you say it's like a dull pain or a sharp pain or kind of like a stabbing pain or?
When in the movement, it's a sharp pain.
Okay, so it kind of hits
And
really fast.
touching in a certain place, it's a sharp pain.
Okay.
And then it's a dull pain probably after.
Okay. So once you stop doing that movement and kind of start trying to make it feel better, it's kind of just dull and hangs out for a little bit.
Yeah.
How long do you think it kind of hangs out and is dull?
No longer than 5 minutes.
Okay. Okay. Besides if you kind of try to do something else with it, like you said, it's kind of sore.
Yeah, and it could be like if I'm at the computer for a long time, that it just starts to get sore, like irritated.
Okay.
So that's kind of a prolonged pain because of its constantness.
Okay. So just a few things. I was looking at the chart here. I noticed that you have a family history of some cancer and some stroke. If you feel comfortable, would you mind just expanding on that a little bit for me?
On my mother's side, her father, so my grandfather, had those issues.
Okay.
Yes.
Okay.
Yeah.
So he's had his multiple strokes? Just one?
Yes, multiple.
Okay, and then do you know what type of cancer he had?
I believe it was thyroid cancer.
Okay. So, as far as your family situation right now, do you have somebody at home to help you and support you? Do you live with anybody?
Yes, my husband.
Okay.
And my dog.
Okay. Your husband and your dog. Nice. Is your husband kind of there and willing to help you with therapy and things like that?
It depends.
Okay.
It depends.
Depends on what?
His mood.
Okay. All right. Well, we'll try to get him in on this. So, I'm just going to keep going, ask you a few more general questions. How do you feel about your health? Do you feel poor about your health, fair, good, or maybe excellent?
Probably good. Getting back on track.
Okay. How much would you say that you exercise currently?
Probably, I walk almost every day, and then I'm trying to work out at least twice a week.
Okay. Does the risk kind of prevent you from working out sometimes?
I would say it makes me nervous.
Okay. Do you think that you, or would you say that you exercised more before you began feeling the pain?
Yes.
Okay. How much do you think that how much did you exercise before you kind of experienced this pain?
Quite a bit more, probably.
Okay.
4 to 5 times a week.
4 to 5 times a week of kind of doing some more active stuff like push-ups and things like that use your wrist. Okay. Everything else looks good on the chart. I don't have any other anything else to be worried about as far as any health issues or anything like that. But is there any health issue or anything that has come up recently that's worried you that you'd like me to know about? Any, for example, on here there was loss of appetite or difficulty sleeping or anything like that you feel concerned about?
No.
Okay.
I don't think so.
Okay. All right. So, I am going to do some stuff with you. We're going to really try to reduce that wrist pain, see what we can do about making it better. It says on your sheet that you would like to, out of physical therapy, you want to be able to type more without pain and exercise more without pain. So I think we can definitely work on that and get you towards those goals. So as a physical therapist, I'll be prescribing you exercises, and I'll be doing possibly some manual therapy on you, so working on your wrist with my hands. And as a patient, I would just kind of expect you to do the exercises that I give you when you come in therapy, and then also at home, and that's why I kind of asked about your husband. He can help you with those and help you keep on top of that. How does that sound to you? Do you think those are good goals to have and kind of get us working towards what we're going towards? Okay. I saw your learning style is best when you do stuff, so that's great. We'll get you doing some exercises, and you'll definitely learn them, and you can keep doing those. So just to kind of summarize, you've had this wrist pain for a couple years. You've had some treatments that haven't really seemed to help a ton, including one session of physical therapy. And so, what aggravates it most is your occupation and your hobbies. So when you're trying to be active and when you're at work, it kind of comes on pretty fast and is pretty sharp, but it can calm down pretty quickly as well. And I think that you do well with icing it and taking some ibuprofen. Yeah, I think we can go from there. I have a few tests that I would like to do, and then after that, we can kind of start getting going with some exercises and stuff today. We'll start off a little light, and we'll get working towards getting you back to doing some tennis and push-ups and being able to type without pain. Does that sound good?
Great.
All right, sounds good.